Hello and welcome to this clip and also to my YouTube channel. My name is Chris Radnich. I'm a Bowen therapist and a soft tissue therapist in Canberra, Australia. I treat conditions of the spine, musculoskeletal injuries all day. I've been doing this for over 20 years. And what this clip is about is the still point and how to get the still point, where the location of the still point is and how you can really emphasize its use and get the most out of it, and also what, why and when you would use it too. So this what I'm holding here is a makeshift still point inducer. So you can make this very easy. All it is a sock, and I recommend a Star Wars sock as well. It seems to work better. And we get two tennis balls, put two tennis balls in the sock right down to the end, tied off nice and tight. So there's two tennis balls and there's a gap here that the balls will form. And the bony protuberance of the back of the head will sit in this area here. And then the still points will be contacting the balls here. So you're laying on a hard surface or firm surface. Your bed doesn't seem to work as well. So laying on a carpeted floor or a yoga mat. So just so it's a firm surface, then we're putting these on the back of the head here, which I'll show you where the points are in a moment. So this technique is based on the principles of craniosacral therapy, which is an osteopathic technique. It aims to reset the entire central nervous system. That's the main goal of what we're doing here, and it's profound what it can do and how easy it is to get that effect as well. So the cerebrospinal fluid is one of the main fluids in the body, along with blood and lymph. So the spine is a casing, bony casing around the spinal cord, and then the spinal cord connects into the brain. And then the brain floats in a fluid called cerebrospinal fluid, and the spinal cord also is floating in this fluid too. So that fluid system, it's quite an intricate system of membranes and the fluid itself, and then how that fluid moves in and out of the brain around the spinal cord, how it fills and refills all the time. And there's a rhythm that goes through the system. Just like your heartbeat has a rhythm pumping blood, there's a rhythm that moves the cerebrospinal fluid. So what this technique aims to do, it aims to gradually find a still point where that fluid, that rhythm that's moving, comes to a point of stillness. And then when it restarts again, it's like it reboots the system. It resets the nervous system, and you can feel it quite noticeably. So this technique, it calms, balances and reorganizes the central nervous system really well. And it's quite profound how it does that. And it does that quite easy. And the main thing with this is very easy to do. So indications for use is if you feel really stressed, it'll knock the stress out big time for you because it's rebooting the central nervous system for you. If you feel pain, pretty much anywhere in your body, but especially in your neck, in your spine area. If you just want to relax, it'll deeply induce relaxation into your body. If you feel overwhelmed in your mind, overwhelmed in your body, it'll help that to drop out, to feel very calm, very peaceful and very still, which is the idea of the still point. It increases immune function. So when the body gets really relaxed, the body goes into a state of heightened vagal tone. The vagus nerve is one of the cranial nerves that goes in and innervates all the internal organs. So how well you feel depends on the vagal tone in your body. So if you've got high vagal tone, it's a very good thing. You feel very healthy, really well, lots of energy, not really much chronic pain, if at all, and you feel awake and relaxed. If you're really stressed though, the cortisol is the stress hormone, it'll be raised, and as it raises, the vagal tone drops, so it'll be low vagal tone. So one of the resetting things that this technique does for the central nervous system is it raises the vagal tone and decreases the stress hormone, the cortisol in your body. So it's really good if you just want to relax, really deeply relax. So when your body has increased vagal tone, the immune system improves. So that's where that helps. It relieves pain, relieves stiffness in the body, especially in the head, neck, jaw, shoulders and spine, pelvis even as well. Good for pelvic floor issues too as part of a treatment. If you feel emotionally dysregulated, so you don't feel balanced, you don't feel stable maybe in your emotions, you have lots of thoughts that keep looping in your head that you can't sort of switch off, this will help that big time for you. So it helps regulate your nervous system. For headaches, very, very useful, especially for stress-based headaches, even hormonal-based headaches as well, be very, very useful. So it's really great for therapists. It's great for teachers, people working in an office, working on computers, people managing a lot of people with a lot of energy outlay, overseeing people, and especially for athletes as well. Athletes who are either overreaching, which is a good place for athletes to be, or overtraining. It helps the nervous system to rebalance and regroup again, so you can recover better. So before you begin the use of the still point inducer, there's some medical conditions that are contraindicated. And to be honest, these ones are ones that if you've just been in a recent accident to do with your head or your neck, and most likely should be in the hospital or even in the intensive care unit. So these things are to do with if there's any concern about changes of pressure in the head. So such as a recent skull fracture, a really bad neck injury, raised intracranial pressure, a herniated brainstem, a brain tumour, acute concussion, and along with that can come a subdural hematoma. So if those things, definitely don't do this. If you have a symptom of a cerebral aneurysm, is a very sudden and very intense, severe headache. So if you have that, it's one of the main signs that there's a ballooning artery or a bleed in your head. So don't do it if you have that. Go to the hospital. It can save your life. And an acute stroke. So how to locate the still points? It's quite easy. So the top of your ear, if you just follow the top of the ear around, you'll run into a pointy bit right in the back of your skull. So a pointy bit that sticks out. So that's the external occipital protuberance. So it's a bony bit that sticks out. If you were to go down a little bit, once you get there, you'll run into a divot. So we're not in the divot, we're on the sticky out bit. And then the balls will go either side of that sticky out part, okay? Or another way to think about it is the very center of the ball here. The center of the ball goes in line with the very top of your ear, so that height, and it'll hang around that point there. So on the skeleton here, it's pretty much the most furthest back part of the skull. So I'm not up here, I'm not in here, I'm right here. So the top of the skeleton's ear will be about here. So I want the center of the ball to be there as well. So we're just laying on that on a firm surface. And we can lay on this for as long as we like. It can be done 1 to 2 times a day. And people usually get the effect of this with about 10 to 20 minutes. And if you go to sleep on it, fall asleep, it's a good thing. And it's okay to do, it's not bad, okay? If you feel any discomfort at all, just take it out and just lay down for a couple of minutes, roll onto your side and get up from there, but I'll explain that now. So to do the technique, you're laying on the floor, on a yoga mat, a firm surface, then placing the still point inducer underneath the back of your head, the middle of the ball in line with the top of your ear. Just making any adjustments. If you feel that it wants to slide down your neck, you're a bit too low. If you feel like it wants to slide up your head, you're a bit too high. So you're finding that point where it just sits the best. And that's the points that we're after. Tongue's on the roof of the mouth, just lightly, and breathing in and out through the nose. And within a few seconds to minutes, you'll feel your body releasing tension and stress, releasing pain and discomfort, and you relax more and more and more. As time passes, you'll perceive your body and mind becoming quieter and quieter. So very quiet even. That you'll perceive your mind and body drop into a state of stillness. And this is the still point. Everything becomes very still, calm, restful, and nourishing. When you're finished, take the balls out, let yourself rest on the floor for a couple of minutes. There's no need to rush getting out of this. It's actually better to take your time. Then rolling onto your side, just resting there for 30 seconds to a minute, more if you need. And
and then getting up about your day after.